Welcome, everyone. It's Angelo Robles to the Angelo Robles podcast. I'm also the founder and CEO at Family Office Association. Today, we're going to cover senior living investing in 2021 and beyond, how a single family office aligns its impact investments with results. It's going to feature Kamran Jahangard, CEO of Nationwide Investment Group. He is also a family principal in a single family office at a beautiful Malibu, California. As mentioned, he's an investor and owner operator in many senior living facilities across the United States and has conservatively evaluated or executed over $1 billion in senior housing through buyouts, projects, and partnerships in just 2019 and 20 alone. Cameron, it's great to see you again.
Good to see you, Angelo. Thank you for having me.
So, to give our audience a little bit of context, although kind of noted in the title, Cameron is a family principal of a single family office. So, at the heart of Family Office Association, that really is who we are, providing value and benefits and peer to peer connectivity for our members. And I always find it intriguing. To be curious and inquisitive, how our members effectively made their money, their successes, their failures, how they overcame resiliency. I think all those are intriguing stories. And learning a little bit about Cameron and meeting some of his family at multiple events that I've done over the last couple of years, it's been great to get to know him and how active he is broadly in investing, but specifically in what we're going to talk about today. So why don't I start off, Cameron? For those that may be a little unfamiliar, senior living investing, that's probably a pretty broad term. What exactly does that mean?
So, senior living investing to us essentially is investing in either the real estate or actually the business operational facilities that encompass senior living. It comes in different facets. It can be anything from senior apartments to independent living to assisted living, memory care, or skilled nursing facilities, also called nursing homes. A lot of people, when they think of senior living, they just think nursing home,
Mhm.
and that's very common. But there's actually multiple facets to that, and depending on the sector within senior living, some of it is has a real estate component to it, and some of it has a services component to it. So you have acuity of residents, and the higher acuity of your resident, essentially, the higher acuity facility they would go. Um, so that's anything within that spectrum is really considered senior living, even age restricted apartments.
Interesting. And yes, I would agree with you on the surface. The first thing that pops to my mind is nursing homes. But thinking that it's far more broad than that. And that makes me think a little bit about our demographics here in the United States and to some degree in many developed countries around the world. People are having less children. The baby boomer generation, I believe, is the largest, and some of them are at this stage, I guess, well into their early 70s, if I have my math on baby boomers correct. So we have an aging population. It does seems like, just looking at it from a demographics perspective, this would be an intriguing market to be in. And again, don't be limited into the perception of nursing homes. And we're going to get to that and maybe some of the misconceptions as well. It's far more broad than that. But how do the statistics, the demographics shape up in terms of what you come across?
Yeah, so I think what we're going to be talking a lot about today is the United States demographics. Obviously, when we go on a global scale, we're with countries such as Japan, where you have an
Yeah, it's
aging
worse.
population, and yeah, and it gets worse. But also culturally, it's a little bit different. In the United States, we have a culture of service. We're a first world country with first world problems. And so we actually do like people to cater to us as a part of the American culture, and so we are willing to invest in services to make mom and dad comfortable when they reach that age. When it comes to demographics in the United States, yes, the baby boomers are the largest population group, but every generation after that would actually sustain the population count in terms of care needed after the age of 65 or 70.
Hmm.
Currently, today in the United States, 10,000 people a day turn 65. That's a very large number. In order to keep up with this demand of aging population, 100,000 units are needed to be built every single year by the year of 2045 in order to keep
Wow.
up with that type of demand. So the supply is really lagging in the senior living market, and you're going to see a lot of new construction projects. I'm pretty sure a lot of people, even on this call, have seen a senior living facility close by to where they live. They're popping up all over the place, but they're also not in. They're not very on these high traffic areas. They're more on kind of the secondary tier type of traffic streets, and exposure. It's not the same as retail. And so, when we talk about the United States demographic, we have the baby boomers, but the populations after that are going to sustain in terms of demand, and that's not including immigration. The immigration population also adds to that demographic, where people want to retire in U.S. healthcare. And now with COVID pandemic, a lot of people do not even want to burden their family. 95% of seniors that move into assisted living or assisted living or memory care of their families would all agree that 95% of them believe that their elder is safer in a senior living environment. They don't want to burden their family. They don't want to expose their family to unnecessary dangers, and they want more social interaction in a controlled environment. And so that's why we've been seeing a lot of increase in occupancy. And I'll go a little deeper later on in this.
And I mean, some of it relates a little bit to culturally, as you noted, in other parts of the world, it may be more common, and not to argue right or wrong, but for generations in a family to be together in terms of taking care of perception, quote unquote, respect of elders and all that. And again, I'm not looking to make it right or wrong. That does not appear to be as strong as a cultural perspective here in the US. Uh, and that creates the opportunity for independent senior living around the world, but we're talking more specifically here in the US and the reasons why, from both the demographic as well as a cultural perspective, it may be something of an interest for those looking at it from a real estate perspective, like you said, and also a business operating perspective. It just seems like there's certainly great potential here. So, my question is, how has COVID impacted senior living? I almost don't want to venture to guess. I want to hear your opinion.
Well, I think that I think it really depends. I think a lot of people are surprised to hear that not every senior living facility has been plagued by mass infection and deaths. When we look at it per sector, now remember there's a real estate component and a services component. So when you're dealing with independent living or senior apartments, that's just a real estate segment. It's a real estate driven. There's not really any services that are provided with that. Now you go one step further where there's services provided like assisted living facilities, and now you have caregivers that are providing care for elders that need help in brushing their teeth, putting on their shoes, dressing, taking a bath, whatever it may be. And it can go up, from there all the way to hospice, really. Um, and when it relates to COVID, you're dealing with staff that's already been medically trained. They understand how to avoid cross contamination. The chef and the cook already have the credentials to understand how to keep their workplace clean. You also have the caregivers and staff that can adapt quickly, and they have procedures for high alerts if need be. So they are already kind of geared to be able to move quickly and adapt to a very rapidly changing environment. Not only COVID as a virus or as a plague, as some people put it, but also with the ever-changing laws and regulations that come with it. And in understanding, well, why is it important to take temperatures and how you take temperatures and how often do you do it? Residential care facilities for the elderly, which is where the licensing is done, is the department where the licensing is made. They put a lot of regulations out. When a facility contracted COVID, a lot of people don't know that the facility would stop you from move-ins. So larger facilities were impacted greater because unfortunately death is a part of is a part of the business, for a lack of a better word, but it's a part of life. And so whether or not someone passed from COVID, um, if your facility had a COVID positive test, the state of California required a minimum of 5 weeks of COVID-free new infections at your facility before you can even start moving in residents. So there's some larger facilities, 100-bed units, they went all the way down to 50% occupancy just because they either handled it wrong, they couldn't stop the rapid infection throughout the facility, and they couldn't essentially create a 5-week consecutive period of zero COVID tests. I mean, that's pretty difficult to do, but when you're dealing with experienced operators like what we deal with Nationwide Investment Group, we make sure our operators have a minimum of 15 years experience, and they've been through it, so they understand how to really avoid cross contamination and infection throughout the whole facility. So our facility was only shut down for the minimum 5 weeks when we had COVID, but we did an outstanding job and only had one person lose their life due to COVID. Most people, when you're talking about assisted living facilities, 64% of those facilities had zero COVID deaths. 64%. So it's really high in the majority where these senior living facilities had no COVID deaths. Independent living, is same. It was the same as the county. 67% had no COVID deaths. When you go higher in acuity, memory care, that's a very hard segment to really tackle, because you're dealing with people of Alzheimer's or dementia, and you're trying to guide them in trying to stay in your rooms and try to segregate the population. That's very difficult to do with someone with Alzheimer's or dementia. Yet 61% of those facilities across the US had zero COVID deaths. Surprising. When you go to higher acuity skilled nursing facilities, you're dealing with people discharged from hospitals, from surgery, or they need to go through physical therapy, occupational therapy, or speech therapy. Those facilities were hit a lot harder, the nursing homes that we all talk about. Part of that was, government related. Part of that was, operationally related. If your operators weren't able to handle COVID properly, or, weren't able to really segregate the population, then they really achieved really negative results. So 39% of those facilities had zero COVID deaths, which is still, I think, relatively good for what we had to go through. So that means only 61% of those facilities actually had a COVID death. So I think that's really surprising to a lot of people, and that's where the most services are done in a skilled nursing facility.
And maybe more so through kind of the PR and what happened with COVID, but looking at it from an investing perspective, and again, maybe real estate and the business side of it, it seems like there would be a fair amount of both federal and state regulation. You gave the example there in California. And also, and maybe this applies more so specifically to skilled nursing homes, the fact that they are expensive. A lot of people are not going to have the resources to pay for it. Therefore, it probably goes on a combination of federal or state aid through Medicaid. How does that all interact in terms of looking at it from an investing perspective?
Sure. And from an investing perspective, really skilled nursing facilities, nursing homes, a lot of those are Medicaid, Medicare type of facilities. That's the highest reimbursement for skilled nursing facilities. So you have that level of care there. Because it's so service related, a lot of owners will only choose to own the real estate and lease the property to an actual operator. So like a traditional triple net lease type of situation. Now, when it goes to assisted living facilities, even though there is a services component, it's not recognized by the state or the federal government as a medical facility, surprisingly to a lot of people. So assisted living is a very interesting niche, and that's where we like to invest our capital. The assisted living market, memory care market, because it's not viewed as a medical facility with the state and the federal government, it has the notion that it is a medical facility to the outside population. So that barrier to entry actually keeps people away from that industry. But because it's service related, there is a business component that's related to these facilities, but you could still do your traditional real estate investment where you actually buy the real estate and lease it out to an operator. We've even created joint ventures where the operator has a first right of refusal or an option to buy the real estate, but they don't have the capital to actually, acquire the building. So we would come in and joint venture with them, and we would provide the capital to enable them to buy the real estate. They would continue to run the facility because they have experience running the facility, which we like. And they understand the market, the demographics. They would continue doing what they do, and then they actually can get some upside in the real estate value ownership as well. So those are a lot of the strategic type of joint venture agreements that we like to do at Nationwide Investment Group as well.
Interesting. So, a couple of things that we've been talking about, the demographics here in the US in terms of an aging population, some of the things we spoke about with federal and state, and in COVID, which sure, we still are, but hopefully coming out of it and things are opening up more. How should an investor be investing in this space right now? What are key things they should be looking at?
Well, first, I would say, really get familiar with your local market and local operators. It depends if you're coming in on a real estate or as a joint venture with a business operational partner. Having a right operator, for example, for us, we go out, we look for off-market properties. We believe right now there is a COVID-related discount, which we think is going to go away. Even though a lot of facilities handled COVID well, some owners, especially mom and pop owners, they're tired, they're burned out. So they recognize there is a COVID-related discount there. So it's a great opportunity for an investor to get in right now. Cap rates are a lot higher because it is more business centric as well. But it's a specialized real estate. If it's not operating today as an assisted living property or as a skilled nursing facility, it's very hard to kind of transform that facility to whatever use that you want to do. Typically, it's going to be the highest and best use of that property is going to be either assisted living or a skilled nursing facility. But because cap rates are traditionally higher, it can provide a higher return on investment. With debt being so cheap right now, it causes a larger spread. It's not that because the interest rates are coming down, the cap rates are coming down drastically as well, like it's happening in the apartment sector. Inflation is only going to drive revenues and values up. I think everybody recognizes and appreciates the value of medicine. Although, I mean, that's another subject that we can talk about, pharmaceutical prices. But there's a lot of costs that are associated with caring for a loved one. And these increase in costs are going to increase revenue. And when you increase revenue, it's going to increase the bottom line and increase value. So I think an investor should really be looking at two things. One, educating themselves with the local market, and then educating themselves and working with professionals that are seasoned in the industry to actually point them in the right direction to what's happening locally with them. There are some, let's say, memory care saturated markets. There are some senior living, high-end, saturated markets, such as St. Augustine, Florida. You have to be looking at new construction and what's existing on the market and make sure that your local market that you want to invest in is not overly saturated with not only new construction projects, but ones that are coming through the pipeline. And so those are all things that I would be considering when investing in a senior living facility.
Real estate is always and always has been just so localized. It's very different from whatever, New York to Seattle to St. Augustine to San Diego to Nashville, etc. Which some of the inefficiencies in that market make it intriguing for people relative to what interest and cap rates are, opportunities for leverage, and those that simply have an in a given marketplace or a knowledge advantage. It definitely matters. You said something, it may be a little off topic, but using one sector of real estate like multifamily housing, you think that there's less millennials and younger generations buying homes. That would be good. And again, some markets are very, maybe let's go with the word tenant centric, probably in California and New York, that make it more complicated or makes it more complicated given something like COVID, when there's to some degree a little bit of a no pay culture and certain federal and state regulations that make it difficult in terms of for the owner to collect. Is that somewhat similar Not as much probably in skilled nursing, since a lot of that is paid by federal dollars anyway. But in terms of assisted living facilities, how has COVID impacted from that revenue perspective?
Yeah, so outside of, decreases in occupancy, which are now
Yeah, that's
past,
big.
past pre-COVID levels. But we didn't have any collection problems, if that's what you're asking. The
Yes.
collection rate in an assisted living facility was very close to 100%. And the
Wow.
reason for that is because if mom or dad is at an assisted living facility, and rent is not paid, there's a portion of that that goes towards the services that are there for mom or dad, and those are daily life necessities. And if rent isn't paid, then those services can't be passed on to their loved one. And what happens when mom and dad moves out is they're the ones that are going to have to be taking care of mom and dad. And part of the reason why mom and dad are in those facilities is because it's a very, caring for a loved one is very hard. It's burdening. It's sometimes even frustrating, and it's very stressful. And so sometimes when you're passing along those services to a caregiver, for someone to take care of your loved one, it's very important, that they understand what is actually involved with that. And so a lot of people really appreciate those services. They actually also like, which is a very common theme, depending on generation, it's a community, it's community oriented. um, you know our residents get to know our caregivers on a one-to-one basis. Everybody that walks around says hi and bye to each other. It's a very friendly community. So it's like a town within a town. So even though real estate is very localized, I would say the facility itself is such a local it's such a local market, in itself. When you're buying food and paying attention to the nutritional values of the food that's coming in, and also paying attention to everybody's nutritional needs, even the chef or the cook gets to know you. And so I think that community can never be eliminated. I think once you're in a senior living asset class, and we're talking about revenues and rent collections and all these things, there's so many other markets that can be replicated very similar to the senior living market. I mean, we have student housing, very similar to senior living, outside of there's services involved, and but there isn't any communities outside of student housing. I'm pretty sure there's a lot of millennials out there, myself included, that would love to live in a community of people that are all like-minded as myself. And I think that'll never go away, really.
And it's probably one of Angelo's crazy questions, but there's many of them.
I love
Uh,
your questions.
what could be, and maybe this is more 10, 20, 30 years out, I don't know, but advancements in anti-aging, biomed, medical, there seems to be a lot happening right now, and even potentially much smart or smarter homes, robotics. Could this be a negative to senior living, and that people may be, I would almost say, reversing the aging process being one, and the other simply being, like I said, smart homes, robotics may allow them to be more independent in their current home? Is that a risk to the industry?
Well, I think the industry of senior living in general, I mean, the biggest competitor is the person's home. So this is something that people are used to, and they're okay with, giving up their house to go live in a community where activities and services are provided. So when we talk about smart technology, we talk about AI, we talk about improvements and advancements in human health. These are all good things for the industry. I mean, when we're talking about population demographic, we're talking about need. So the average 65-year-old today is not the same as a 65-year-old 200 years ago. We all understand that. You're more active, you're more independent, you're more willing to do different things. There's a lot of CCRC communities where they actually include the continuum care spectrum. So they have independent living, assisted living, and skilled nursing all under one roof. So as you age and you increase in acuity or your health diminishes, you stay within your community, you stay within that facility, and then you just kind of age with the facility. So I think any advancements in anti-aging, I think, would be great for the industry in general. There's also, There's also cases that have been known that by increasing the interaction, of residents inside senior living, changing their diet, getting them more active, going on daily walks, doing paintings, doing arts and crafts. It's not just bingos and birthdays, it's a lot more, inclusive than that. And that's actually been able to elongate people's quality of life, and quality of life is very hard to kind of measure. It's very hard to quantify, but you see it, in the smiles and the laughs and you can feel it, there's a lot of assisted living facilities that are not your traditional scary sniff or skilled nursing facility, nursing home. I've been inside some of those, and that really got me motivated to really do something different, because I didn't want this for my, you know, I wanted to honor, the legacy of my own family name. And in what better way can I honor the legacy of my own family name than by honoring the legacy of other families and, their patriarchs or matriarchs within their spectrum.
And we kind of hinted at it earlier. I don't think if we put it into the real estate bucket, we may think of retail, office, multifamily homes. But for someone who's a more active investor that wants to be active in something like assisted living, senior living facilities, it kind of is its own asset class, even inside of real estate.
Yeah, and great point. I really think it should be its own asset class. When you compare senior living or senior housing with the industrial market, the apartment market, the hotel market, the office market, and you look at everything, it's the second highest total return by property type in the next year, projected
Wow.
the next 5 years and the next 10 years. It's only second to office. Excuse me, it's only second to industrial properties.
Definitely not office.
Definitely not. And actually, statistically, when we were kind of investing a little heavier, several years ago, 2018, we looked at this analysis and it showed hotel being negative. We really believe that COVID really just accelerated the process.
Of
Hotels
course.
were on track to be a negative return on investment. We can call that the Airbnb effect. We can call that the
That's a part of it.
oversupply of hotels. But then you also have the industrial buildings. You have the Amazon effect with the industrial buildings. We own industrial buildings. I helped build industrial buildings in Tecate, Mexico, in the largest industrial park in all of Tecate, Mexico. So I've been involved with all the different asset classes of real estate, ever since graduating from Loyola Marymount in 3 years with a business law and finance degree. I've seen all these trends. And plus, I have a commercial real estate broker's license as well, active in California, that I use for just, whenever we want to acquire something on our own. But typically, your best deals in real estate are going to be off-market deals, and that's really what we hunt for. And you really have to just diversify, and I think that's why working with private equity groups and syndicators or other families is such a good thing. It's a way for us to invest our capital alongside another family's capital, where we can now diversify our investments and then spread it across. Instead of spending all of our capital on one property, we're investing in 5 different senior living properties across the U.S., and we're able to diversify and create an asset allocation within senior living itself, which is interesting, and it provides a better return for us. But when you're looking at property types, senior living is projected to be second, and it's north of 12% over the next 10 years.
Excellent. And, like you said before, it's potentially a real estate play, obviously, of course, but also from an operational perspective, which could be potentially lucrative from an investor. Assuming the successful families listening or viewing in don't have the experiences you have, which 99.999% of them won't, they're going to be looking for operators, for lack of a better word. How do they identify the right operator and something that is, under the auspice, although like you did say, with assisted living, not nowhere near as much from as, say, a skilled nursing home, but nonetheless, how do they source the right operator?
So, operator, in senior living, it's operator, 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 not location, location, location. It's very it's the value of your property is cap rate based. So if an operator can increase the NOI by $10,000, that's a $100,000 increase in value. So, but vice versa. If they decrease your NOI by $10,000, they're lowering the value of your property. So you definitely want to create an alignment type of environment. When you're looking for an operator, you want to make sure that they're seasoned. You want to make sure their management team is seasoned. 10 plus years, I think, is a good 10 to 15 years is a good time frame. You want to make sure you do your own due diligence with them, and also have them look at the deal that you're looking at acquiring, assuming you're doing it on your own. Or you can work with a family that specializes in senior living facilities, because they're going to know how to find the operator as well. Your brokers that specialize in senior living can point you to a couple directions, and you should always interview the operator, and then see what they say, and what they view as some pitfalls or things to avoid when you're acquiring the facility. So one example of this is, when we go buy a facility, we look for off-market deals, and it's a mom and pop, and we typically transact between 5 to 20 million is kind of our bread and butter range, and that's on the small side when you're talking about senior living, actually. Because remember, each resident, even if you have, each resident is paying roughly in an assisted living market anywhere from $7,000 to $10,000 a month, and you have 20 residents, it can snowball from there. But when you're looking for an operator, you want to definitely be interviewing them. You want to be interviewing their management team. You want to also know their play-by-play and timeline. If it's a turnaround property, what the occupancy is, what are they going to do different, where are the capital improvements going to go? If you're going to create a wing just dedicated for memory care, why should you go into memory care into this market? You definitely want to be doing a market study. You want to understand the demographics of your local market. And you want an operator that specializes in that. When we invested in a skilled nursing facility in Portland, Oregon, it had bariatric units. And so it was decided that that facility should be run with an operator that has bariatric experience. So we chose Avalon to be the operator. So there's a lot of things you can do to interview people and hire them right, but you also want to hear what their opinion is in terms of the layout, the structure, the employee count, the food costs. These are all things that some owners, especially some sellers, when they have multiple shared facilities, they like to share those costs. Okay, so if you have 3 facilities and you have 1 chef and 1 cook, is the chef and the cook going with your other 2 facilities, or is the chef and the cook staying with me? Because we need to allocate that in our own due diligence process. So, there's a lot of strategy and communication involved in finding an operator, but there's a lot of also associations is a great place to start. The CAF, the California Association of Healthcare Facilities, is great for senior living facilities. CALA, the Association for Assisted Living Association, California Assisted Living Association, is a great one for California assisted living properties. All these resources are put in place so you can find the right operator, but it definitely should be a regional operator. My opinion, if the operator themselves cannot be at your facility within 2 to 3 hours, they're probably not the right operator for that facility.
Excellent points and things for investors to keep an eye on. There is a question that came in. I'll read it. What kind of concierge services and other amenities do top operators offer? The part 2, what is an appropriate cost of those level of services?
Sure. So the level of services are typically baked into the rental rate per month. A lot of the services can involve, like transportation to doctors' offices, transportation to the hospital, assuming it's a non-emergency, transportation to events, like outdoor concerts. I mean, we're talking pre-COVID here. But even post-COVID, there is some outdoor events that are being allowed in certain communities. Now, remember, it's localized. So if you're dealing with a population that wants to be out, they're going to be out, whether you like it or not. Some can also include, obviously it's going to include laundry, food services, arts and crafts, gardening is a big one. There's a plethora of them. I think if you went to any facility and you asked them what their activities were, they would give you a whole list and a printout, and possibly even like a schedule as to which dates they're going to be doing things, which dates they're going to do pumpkin carvings, which dates they're going to start planting their pumpkin seeds so it can be ready for October. So Angelo, if you haven't already, I suggest you start planting those pumpkin seeds because they're going to be ready for October, and now's the time to do it. So
Now,
look,
now would be the time to do it. I'm in the greater Northeast. That's a big thing here. The decision to move to a senior living community is an important life event. You may live at that senior living community, I could argue, for decades. What questions should one be asking when choosing a community to live in?
so I would understand their COVID regulations. I would understand their policies that they put in place with COVID. I would get an understanding of their turnover rate for their employees. Their caregiver staff ratio to resident is a big one. In our facilities, it's a little more white glove, higher end. So we have a 5-to-1 caregiver to resident ratio, which is very, very good, very high. Most facilities have like 15-to-1, 20-to-1. And so I would look at the caregiver to resident ratio. I would look at the types of activities, what's included. Is it, who pays for the supplies, incontinence supplies? Do they do medication disbursement? Who's the home health agency that they typically like to call on or use? What services do they provide? Do they provide wound care? Do they provide PT, OT, ST at the facility? Depends on if mom or dad likes a larger facility or likes a little more intimate. It's kind of like going to university. Do you want to be in a room of 1,000 people trying to learn something, or do you want to be in a classroom of 15 students and really get that one-on-one kind of interaction? So I would start there. I would also start at the level of care, nutrition. I would definitely taste their food. A lot of places will offer you lunch, so you can kind of get used to the level of food that they provide. Um, and then I would also speak with, if you're in a skilled nursing facility, I would speak with the director of nursing or the director of rehab. They're called DORs or DONs. In an assisted living environment, it's kind of more of, okay, well, what do you guys suggest we do if a doctor prescribes a medication and mom is reacting badly to it? What happens in that scenario? So I would apply the same principles that I apply when I'm hiring anybody. I always ask them a question where they can provide me a very lengthy, detailed answer, and that would give me an understanding of whether or not they're capable to actually perform those duties for me or not.
And I remember hearing more about it years ago. I don't know if it became challenging for the insurance industry and it's not what it used to be. I have no idea. And maybe it was more applicable to skilled nursing facilities, but is long term care insurance, that insurance option, still a potential value, a benefit, a factor in all the things we're talking about?
It is, but typically long-term care insurance is paid to the family. It's typically paid to the family, and then the family uses those funds to kind of pay for mom and dad to go to a facility. So um, that helps subsidize their payments. So that's why when we're talking of residents paying north of $8,000 or even $10,000 a month,
Yes.
how does a family even afford that? You have all the brothers and sisters come together. Typically, it's the eldest sister that really takes care of mom or dad. That's really the demographic. Our number one customer is not really, the 85-year-old resident. It's really the 65-year-old daughter.
Right.
Um, it's not always the oldest, too, surprisingly. Um, but I would really I'd really look at all those factors really when you're looking for a facility.
How should one think about the care of loved ones with, it's a sensitive topic. Hopefully, we're getting better from a medical perspective, but of Alzheimer's and simply the consequences of cognitive decline with older ages?
So cognitive decline in older ages, especially in Alzheimer's or dementia facilities, memory care facilities, it's very important to understand the nutrition that's involved in the activities. Um, a lot of times on later stage Alzheimer's, for example, there is a lot of long-term memory that's not impacted. It's really the short-term memories.
Yes.
So they kind of revert backwards a little bit, and that's a great time, really for a family member to really get to know their parents or grandparents on a deeper level. It's not, hey mom, how was your day? Hey mom, tell me about the best time you went to the beach. or what did you do with your mother when you were younger? Stuff like this. These are different questions to really kind of um, help get the memory going and also relive those treasured moments that you would never hear otherwise.
Very true. That's very good points and kind of a good way to potentially look at that.
Yeah.
From an investing perspective, maybe talk a little bit about what you do and how those that could be qualified purchasers that may want to learn more. And then we'll maybe talk about some alternatives to get some exposure to this, let's call it an asset class within real estate as well.
So yeah, so I mean, I think it really depends on whether you want to be a hands-on owner, which is not going to really be hands-on because the operator really is the hands-on person, or if you want to be a limited partner in a real estate investment fund, or you want to invest alongside another family. It really depends on how involved you want to be. Um, I For us in general, we do want to be involved. We're an operational family. I grew up in a manufacturing environment. I ran a manufacturing company, scaled it from 7 employees to 150. So I understand the HR pitfalls. I understand, the problems with employees, the good parts about employees. But it depends on how involved you really want to be. For us, we like to be heavily involved in the beginning, and then we like to kind of let the operator take charge, and we like to be a guiding force. We like to be a strategic um, guide for our operators to kind of help them in whatever aspects of marketing they may need, or when it comes to contracts or negotiating contracts for food costs, reducing incontinent supply costs, or sourcing. Any of those things on the back end, we definitely want to help out at, but we let the operator shine and we create alignment. So for us, our investment strategy is really to create this alignment with like-minded operators where they want to create this um, environment that's just beautiful and has an amazing quality of life for our residents. Specifically a facility we have in Central California in Santa Maria, it's on 20 acres and it's farmland. So the farmer actually provides us some of the vegetables and fruits that we grow on our property.
Wow.
It has a water well, it has solar, we have a water tank, so it's all self-sustainable um, at our facility. It just creates this grand feeling. It creates this healthy feeling. And when we talk about memory care or assisted living, there's nothing better than good food and good activities and good friends and good conversation. Nothing better than that. And so you want to feel like you're at tip-top health shape, even though you may not be. You want to be able to do certain activities that you wish you could do better when you're in those environments. But when it comes to investing itself, I would say definitely do not go into it blind. Do your research, talk to other families that are involved. I'm happy to answer any questions anyone might have as well. Whether or not we're involved in the deal or not, that's not the purpose. The purpose is to make impactful investments in an industry that's very niche, that's very purposeful, that can honor your legacy as a family, honor the legacy of other families. And so I believe it's my mission to really encourage investments in the senior living environment. I can only see these facilities getting better and better every single year. New construction is just looking amazing. It's like the Ritz Carlton at these senior living facilities, and the more investments we put into this industry, that's undersupplied right now, that has the demand to meet it, the better our facilities can be, and the quality of life, which is very immeasurable, but the quality of life would actually be increased significantly. So sometimes the return on investment, even though it's great for us, we like to do cash flow opportunities. We like to have positive cash flow day one going into it, compared to new construction where you're sitting on it for 3 years without any type of a return. Um, but for us, we like cash flow opportunities, and then we like to deploy capital to improve the property itself or expand the property itself because we know we're doing something right and we want to do it better and enable more people to enjoy it.
Uh, Not to get too deep into some of the tax and technicalities of real estate, but on the real estate side, do potentially 1031s and other strategies, even I guess opportunity zones potentially come into play? I would assume so.
All of it comes into play. Yep. The
Interesting.
interesting thing is because it's specialized real estate, the values of the real estate and the business together go based on cap rates. So you have an operational business that's being sold on a cap rate. And we all know increase NOI and you keep the cap rate the same, the value is increased drastically. So if we can do that on a business sense, right, and we can increase the NOI on the business operational of a facility, then the value of that property drastically increases. When we go to sell it or when we go to buy a facility, a lot of times, I can go to these mom and pop operators and try to put as much value as possible towards the real estate, so they have a higher ability to exchange more dollars and receive passive income that way in their years of their own retirement. They've worked hard in their life. They've done a very noble duty, for the elderly population, and they should be rewarded. A lot of other private equity groups, they probably can't do that. But for us, there's ways that we can be flexible where other groups cannot. And the value in the business is really the value in the license. So some people would even say put the whole value into the real estate transaction. But then, of course, you're going to have a little higher property taxes associated with that. So you have to be careful. So it's a balancing act, but yes, you could take 1031, you could 1031 exchange it into a like-kind asset. You could do depreciation, you could do a cost segregation study if it's a long-term hold and create a large depreciation expense, which a lot of doctors like, a lot of surgeons like, I like personally. And so all the key tools can be used and deployed in this type of real estate investment.
There is a question that came in. Isn't there a number of senior living REITs? And why would I not do that versus something that is more direct? I mean, I know what I would probably say, but how would you answer that?
So yes, there is senior living REITs. I would look at the performance of every single senior living REIT. They're all different. You have, I can probably list maybe 6 or 7 of them off the top of my head that they all have drastically different returns and dividends that they're paying out completely. You have Capital Senior Living compared to Aventas. They're all different. Some are performing really well and some are performing really poorly. And once again, that's within the operator and that's within the culture that they're selecting. So even though you can go invest and buy a REIT right now, that doesn't mean that the result is going to be the same. Because our approach is a little more hands-on, we can control the return on investment. We can deploy additional capital if we need it in certain areas, or not, and save, capital contributions into a facility because we were able to just tweak a couple of things, save some money on food, save some money on medical supplies, synergize our activities and the administrators within the area and reduce the employee costs. There's certain things that we can do to increase the NOI and the value is just there. So when you go to refinance a property, which, with a REIT, it's just a very straightforward transaction. But you have to rely on operators that you don't know. You have to rely on whether or not they're going to be exiting a certain market segment that you want them to exit or not. Brookdale Senior Living, the largest senior living operator in the entire US, exited a lot of leases. They exited a lot of buildings. The lease didn't make sense for them because they were paying such astronomical values on leasing rates to real estate owners that it wasn't worth the investment and the time that they were putting into these facilities. So on a REIT scale, it's all blended in together. And sometimes those numbers, it's a different return on investment. You're talking 6 to 10% max on a REIT, whereas, our capital contributions and investments in senior livings can be anywhere from 20 to 40% annually. That's not including the appreciation or the increase in value or the exit. So I'd rather take a 20% return on investment annually than 6 or 8.
As well as some of the additional tax advantages with some of the things that you mentioned prior. For those, Kamran, that would like to learn more about you and learning more about this asset class within real estate, how could they learn more? Is there a website? Is there an email they could reach you?
Sure. Yeah. Our website is nationwide-investment.com. That's a dash like a hyphen, and investment is singular. And then my email is Kamran with a K, Kam as in Mary, Ran as in Nancy, at nationwide-investment.com. And please feel free to reach out to me with any questions you may have, or even if you wanted to brainstorm or poke a bear, or even get, opinion on, is this operator, you know, they're saying they can do this. Is this even feasible? Or, is this the right operator in this area? And I would tell you yes or no. I've had several family offices send me deals and say, what do you think about this? New construction, this is the market, this is the demographics, this is the contractor fee, the construction fee, the management fee, the this, zero cash flow for 3 years. They're going to exit in 7 years, and it's going to be a 20% annual return on investment. I was like, that's way too low. There's so many fees that are coming out in the beginning, and plus the construction costs that they're putting in there based on what values. And now we all know today, as of 4 months ago, lumber costs is 4 times what it used to be. So we know that construction
Yes,
costs is not something that we can rely on. So
for
there's
sure.
there's a lot of details in the due diligence period that we pay attention to. And so we just like to be sharp and focused.
As I'm going to give a close, it'll be about a minute. If you want, and this would really only be applicable to our live audience, but in case they didn't have time to write some of that down, in the chat feature of Zoom, Cameron, if you wanted to list your email, that would be fine. Do you know how to do that?
Yeah, I can
Okay,
do that right now.
I'll let you do that now while I do about a minute to 90-second close. So those live participants, if you weren't able to write that down or don't want to wait until the video, Cameron should be entering that into the a chat feature of Zoom right about this second. So a reminder to everyone, there was investment conversations, which we love and are great. Everyone's time horizon, risk tolerances, whether they're a qualified purchaser, their experiences, it's all different. When you invest, you could make money. You could also lose money. You need to do your own diligence. This is strictly from an education per opinion and to some degree an entertainment perspective. So again, do your own diligence and make your own decisions. Everyone, I'm Angelo Robles. I'm the host of the Angelo Robles podcast, and I'm the founder and CEO at Family Office Association. I recommend following us. It doesn't cost anything. And I'm actually active on a unique platform, that being Instagram, simply our company name, Family Office Association. We're very active on YouTube. And for those live participants, Cameron just entered that now. We're very active on YouTube. We're simply Family Office, so you could find the channel. And certainly, we highly encourage families and family office executives to consider membership in an organization like Family Office Association, similar to Cameron and his family, and the value that they would get, especially now that physical events, although more intimate, but we're doing them monthly, Miami, New York, this fall, California, and the opportunity not just to hear intriguing speakers, but to meet like-minded people and develop unique relationships that could be great in business and life would be highly encouraged. And simply go to our website, familyofficeassociation.com, and learn more. On that note, Cameron, it's been great to have the interview about a subject that I've not covered before. It was a lot of fun. And hopefully this fall, unless something really bad happens, I will see you when we do our roundtables in California, and look forward to it.
Look forward to it, Angelo. Thank you for the opportunity, and I've really enjoyed Family Office Association. So thank you for providing this platform for everyone to connect.
Thank you so much, Cameron. Thank you for your kind words. Bye-bye.
All right, bye bye.